You have many options if you'd like to participate in a research study. Some test new drugs or devices, others use surveys or observation to gather information. Each study is trying to find better ways to prevent, diagnose, or treat health problems, and each has different requirements for how, where, and how long you participate. You might think studies only happen in hospital settings, but they take place anywhere, from a clinic to your very own home. The University of Pittsburgh also conducts many community-based studies. For the past several years, Melanie and Arthur Suddeth have participated in a study called Heart Score. It evaluates race and gender-specific risk factors for heart disease. They learned about the Heart Score study at an outreach event at their church.
I love the fact that it's community-based, the fact that the community doesn't have to come to them, they come to the community. And when I went, I was just truly impressed with the level or the quality of engagement that the staff had. I was very impressed with the testing, that it was free, and that you get your test results immediately.
It was enlightening because I didn't know all the problems I had.
When we go out into community, it's really to build relationships, in addition to get them familiar with who we are and what we do and what is clinical research. Sometimes it is a questionnaire that we'll ask them to fill out. Sometimes it's just education on clinical research. Sometimes it's just a simple blood pressure or a cholesterol screening or a blood glucose screening in the community. We need healthy people. We need people of different races, different ethnicities. We need male, female, young, old. And so to be able to go and to share that information in the community, for me, would be a good day.
The Office of Clinical Research Health Sciences at the University of Pittsburgh offers a website where you can learn more about clinical research, the rights of participants, and frequently asked questions. You can also find information about current and ongoing studies. Some studies need people with specific conditions or diseases, and others want healthy volunteers. The study may involve visiting a clinic, or a researcher could come to your home or community. Clinical studies also need participants to test new medical devices. At the Veterans Affairs Medical Center outside of Oakland, Dr. Rory Cooper heads the Human Engineering Research Laboratory.
Our question is, how can we sort of continuously improve the function, performance, quality of life, and community participation of people with disabilities and older people through advancing engineering and clinical research? We're doing some things that I think are pretty cool.
The maze as quickly as you can without running into the walls.
We're doing a lot more work in computerized assessment, virtual reality type training. So we've been working on trying to make it easier for people to drive electric-powered wheelchairs, for example. Another study that we have is looking at the Americans with Disabilities Act and how are ramps designed and how long can they be and how wide should hallways be and how doorways and even washing machines and where the control should be in shelves in stores. But in the long run, this is what the community is going to look like.
Some of the studies also improve wheelchair design and lessen the repetitive motion injuries that affect many wheelchair users.
We weren't made to make this movement, and it wears out your shoulders. Also, having your hands like this, turned like this, and pushing is one bad thing for your wrists.
Tom is a paralyzed veteran confined to a wheelchair since 1990, so he knows that improved technology translates to greater independence and better long-term health.
Somebody has to, go through the studies, and I feel like I, helped in a little way of just being one of the persons that went through that study. It's just something that you could tell your kids or grandkids, or they could say that their grandpap was in different wheelchair studies, and that's why they have better wheelchairs today.
Clinical research needs participants. Without the community support, we can't advance our research.
Good morning. How are you?
Fine. How are you?
Good to see you.
Thank you. You too.
Richard Peterson tested another kind of medical device, one that was surgically implanted after traditional treatments failed to relieve pain from a back injury. Before his injury, Richard was very active, running marathons and cycling. His injury left him unable to participate in these activities and unable to work.
Driving a car was very, very difficult. I couldn't sit for very long periods. It just really took you from what your everyday life was to basically drug you down to nothing.
You know, now this is your 36-month visit.
Pat Karolski, the study coordinator, has been working with Mr. Peterson for approximately 3 years with regular checkups to monitor his health and progress.
I would say more of a follow-up than you normally would for surgery, but you also get the benefit of being checked more often because we had to have some extensive x-rays done prior to have those with us and brought down. So, you know, it's a little bit more than your average, but it's worth it.
So far, Richard and his family, all active in sports, have been very pleased with the results. Richard is back to work and able to resume his favorite sports.
We knew people that had had the traditional surgery. Yeah, they're up, they can go to the mall and walk around, but mowing their grass is difficult, shoveling snow, that type of stuff. They still can't do that, where Rick can.
Now he can shoot baskets with me because I'm big into that, so like he helps me with that.
Having this done at least let me be able to keep that part of my lifestyle that I was doing prior, so to me that was a big plus. I also had the thought, if I can help someone else, if it can be approved and be used for anyone, why not?
Learn more about clinical research and ongoing studies at the University of Pittsburgh. Visit our website or call today.